With the Lucky Land Slots, you can get lucky just about anywhere.
This is your captain speaking. We've got clear runway and the weather's fine, but we're just going to circle up here a while and get lucky. No, nothing like that. It's just these cash prizes add up quick. So I suggest you sit back, keep your tray table upright, and start getting lucky.
Play for free at LuckyLandSlots.com. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18 plus terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, Eric Christensen, pharmacist. Thank you so much for listening. We hope you find this podcast educational and it can help you in your healthcare career, no matter what profession you're in here. So, with that said, we're going to cover dexamethasone today. So dexamethasone, brand name of this medication that I've heard most often in clinical practice is Decadron, and this drug is a corticosteroid. Okay, so corticosteroids can reduce inflammation by decreasing production of many different inflammatory mediators. In addition, it also suppresses the immune system. And also can have antiemetic effects. Now, I don't believe the mechanism of action with the antiemetic effects is well understood, but it's definitely something that has been shown in studies. So thinking about this mechanism of action, thinking about this classification, it is a corticosteroid. So I have covered prednisone, but I wanted to cover this med specifically because there are kind of some unique things with this medication. So let's talk about uses a little bit. So obviously a corticosteroid, similar to prednisone, it can be used for those inflammatory conditions, so rheumatoid arthritis, asthma, things of that nature. Chemotherapy-induced nausea and vomiting, which I'll kind of talk a little bit more so about throughout the podcast there, but basically as an add-on therapy to some of our other agents like ondansetron, maybe aprepitant, and medications like that. Additionally, dexamethasone is uniquely used for what's called a dexamethasone suppression test. Now, this basically helps detect excessive endogenous cortisol production in the body. So that's something that you may see this medication utilized for in rare circumstances. And then, of course, we've got the ability to do injections. So IV formulation of dexamethasone is available. So intra-articular injections, for example, to help with pain and inflammation in a specific area certainly can be utilized. Now, in general, why do we, there's lots of things that corticosteroids can help with. Why don't we use them as often as maybe we would like to, given all the possible uses? Well, it's the side effect profile. So when you've got a drug with immunosuppressant activity, obviously that can lead to an increased risk for infection. You're suppressing the immune system, you're suppressing the body's way of fighting infection. That is certainly a risk with dexamethasone and corticosteroids in general. Short-term effects, elevations in blood glucose. This is definitely something I've seen in clinical practice. Even with something like an intra-articular injection, maybe at a specific site or location, that can go systemic and raise blood sugars. Okay, patients often forget about that, and I have certainly interacted with patients that are unsure why their blood sugars are going crazy high, and indeed, looking back through their medical history, their medical record, oh yeah, they just recently had an injection of a corticosteroid. So important to remember that. and not go crazy on medication adjustments with their diabetes regimen if it was noted that those elevated blood sugars are due to just a one-time dose or one-time injection. Because I have seen the situation where we escalate doses of insulin, let's say, and then all of a sudden that steroid goes away, and now we're dangerously low if they were well controlled previous to the steroid use there. So important to keep an eye on those blood sugars in any patient getting a short burst or an injection of a steroid. There are alterations, increase in blood pressure, fluid retention can be exacerbated by corticosteroids and dexamethasone. Insomnia is a short-term one that I have seen with corticosteroids. Rarely psychiatric changes may be with that as well. GI upset, increased risk for GI bleed, ulcer, that can happen with corticosteroids. On a longer term basis, we've got to think about Cushing's type syndrome and HPA suppression. And one other one that I always keep tabs on in patients that I know have taken a lot of steroids over longer periods of time is that osteoporosis risk there as well. All right, one last thing I wanted to talk about before we get into drug interactions, and that is dosing conversions. So it's not something that I would say I've used a lot in my career, but it is something I think that's important to kind of keep tabs on. So probably the most common corticosteroid I've seen used is prednisone. And dexamethasone is technically much more potent. So if you remember what potency is, that basically means you need less of the drug to get the same physiological response. Okay, so prednisone 5 milligrams is approximately equivalent to dexamethasone 0.75 milligrams. So again, dexamethasone is the more potent drug because it requires less of the drug to get that response that you're potentially looking for there. All right, so let's take a quick break from our sponsor and we will wrap up with drug interactions. If you're in the market for pharmacist board certification study material like BCMTMS, BCPS, ambulatory care, geriatric certification, definitely go check out meded101.com. In addition, we've got lots of other resources for various audiences, whether you're a nurse, a physician, med student, nurse practitioner, definitely lots of cool resources there. In addition, check out our list of Audible books. And if you've never done an Audible book, you can get one for free. So go check that out, meded101.com/store. And our most recent book on drug interaction is about 10 hours of content. And like I said, if you've never done an Audible book, you can get that for free. Just follow the link at meded101.com/store and hit the Audible book tabs, and you can go check those out. Also, if you're a pharmacy student, we do have NAPLEX content, so definitely go check that out as well at meded101.com/store. All right, I mentioned my recent book on drug interactions, so you can definitely find a lot more there if you go check that out. With drug interactions and dexamethasone specifically, there's definitely a laundry list of drug interactions, and as always, I'm not going to cover all of them today. One of the first things I think about is the action of the drug and what the drug does. So it's an immunosuppressant drug. So that leads you down the path of potentially blunting the effects and the benefits from vaccines. So recognizing that a patient is on a corticosteroid, an immunosuppressant type medication, is important, and you need to figure out what you need to do with that medication, whether it's a short-term burst that's going to be done and we just delay the vaccine, or whatever the situation may be. You need to pay attention to that if we're giving vaccines to a patient and they are on corticosteroids, because again, it may blunt that response and reduce the benefit you're going to get from that vaccine. Additive effects, I definitely think of NSAIDs and GI bleed risk, so important to think about that. Also, if you've got antiplatelets, anticoagulants on board, there may be a little bit more potential there to raise the risk of GI bleed risk, particularly for the oral medication there. Dexamethasone is affected by CYP3A4. So inducers are going to generally lower concentrations. CYP3A4 inhibitors are going to raise concentrations. Now, I've talked extensively, multiple different medications about CYP3A4 inducers and inhibitors. So a drug like carbamazepine, for example, you can go back and listen and get a few more examples of what drugs kind of impact that enzyme. Now, I will point out one specific example, and a drug or a class of drugs used in chemotherapy-induced nausea and vomiting, potentially with dexamethasone. So a drug like aprepitant can impact CYP3A4, and we may need to reduce the dose of dexamethasone when used in combination with the aprepitant. So important to keep that in mind, and often in chemotherapy-induced nausea and vomiting, we do use combinations of drugs. So definitely keep an eye on that, and it may require a dose reduction there with dexamethasone. Also, more additive effect type things, immunosuppressive agents, so that could add on to the effect of dexamethasone. Also, rarely, dexamethasone may contribute to hypokalemia, particularly in a patient that's maybe on loop diuretics, thiazide diuretics. You may get an additive lowering of potassium levels there. So important to definitely remember some of these things. There's a lot of drug interactions, as I mentioned, potentially with dexamethasone. All right, well, I think that's going to wrap up the highlights for today. Thank you so much for listening. Hope you picked up on some clinical practice pearls. Go to reallifepharmacology.com, subscribe there, and get emails when we've got a new podcast available for you. Also, if you enjoyed the podcast today, leave a rating review on iTunes. Definitely appreciative to all of you who have already taken the time to do that. And share us with colleagues, friends. Shoot an email out to your classmates, students you may have with you, colleagues and things of that nature as well, and share the podcast and help spread the education around. So I'm going to sign off for today. You can connect with me. LinkedIn is probably the best way to do that. Eric Christensen, PharmD, BCPS, BCGP. Or you can shoot us an email at meded101.com as well. Hit the contact button, and that will go to me. Thanks so much for listening. I hope you guys have a great rest of your day.
It is Ryan here, and I have a question for you. What do you do when you win? Like, are you a fist pumper, a woohooer, a hand clapper, a high fiver? I kind of like the high five, but if you want to hone in on those winning moves, check out Chumba Casino. At ChumbaCasino.com, choose from hundreds of social casino-style games for your chance to redeem serious cash prizes. There are new game releases weekly, plus free daily bonuses, so don't wait. Start having the most fun ever at ChumbaCasino.com.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.